Well, as you know, June is Men's Health Awareness Month. A new survey shows 25% of men don't think they need an annual health screening. That same report also shows nearly 70% of men believe that they are naturally healthier than others. This Wellness Wednesday, Dr. Matthew Else with Utica Park Clinic is here to talk about some steps that us guys need to take to, take care of ourselves. That's important. What are some things that we really need to keep in mind?
Well, I think the first thing you should always think of is try to be preventative. So you might think you're being healthy, but it doesn't hurt to have someone take another look and do some screenings, make sure that you're as healthy as you think you are.
All right, when it comes to screenings, Doc, what do we need to do as a guy? Maybe by age group or at certain points in our life, what screenings are really important for us?
Right. So in our 20s and our 30s, if you have a medical condition, you should probably be going annually. If you don't, then it doesn't hurt to go every year, every other year. But for sure, get in there, talk to your doctor, build a relationship. That way, if something comes up, you can tackle it quickly.
Yeah, and there's all different things, right? I mean, just go to the dermatologist to get your skin looked at once a year. You start checking those age markers, and you want to, make sure that your blood is good, that you colonoscopy, all those types of things, right?
Right.
Yeah.
Right. So around age 45, we're going to be doing the colonoscopies. There's even some home tests if you're a little hesitant on the procedure there, but even age 50, we're doing some vaccines like the shingles vaccine. Age 55, now moved down to age 50 is some lung cancer screening. So it's very personalized on what your health is, what your lifestyle choices are, and it's going to be best to talk to your doctor so that they know exactly what you should be ordering.
Yeah, and almost all of that goes back to what you were saying about preventative, which is so important. I thought it was interesting in this study that 70% of guys believe that they are healthier than other guys. How do we kind of overcome that mindset?
I think we should probably just humble ourselves a little bit. If you go in and you get some labs, you might actually realize maybe your cholesterol is higher than you expected. You don't feel that. You don't feel when your blood pressure is a little high. Those are little things that we can catch early, and if we do, we can really reverse them so that you don't end up on medication.
All right, I know you're healthy, you bike a lot, you're in the gym a lot. What advice do you have for all of us just kind of live a better, healthier lifestyle?
Yeah, I would say really make working out part of your lifestyle. Make it an appointment, like going to the doctor. Every week, make a specific time you're going to do it. Don't come up with excuses to possibly miss it. So 4 days a week, 30 minutes should get you started, and then work your way up from there. Okay,
and this is a good time of year for that too, minus the allergies, of course.
Right.
But to be outside, right? I mean, what advice do you have just for maybe somebody that just needs to start small?
I mean, even just walking around the neighborhood, super simple. If you get some hills in there, it's going to bring your heart rate up, you're going to burn more calories, you're going to start seeing more results, and you'll get more motivated to do even more.
All right, we got a little bit less than a minute on the clock here. What about weight loss? Somebody who wants to just kind of jumpstart on that, where do they begin as a guy?
I mean, it all goes back to the kitchen. I love exercise, and I want to really enforce that, but if you're not eating right, you're not going to catch the deficit that you need in order to burn calories and lose weight. So if you can really reduce the amount of calories that you're eating, no matter what diet it is, it's going to come down to reducing those calories.
Keep it balanced, right?
Exactly.
All right, Dr. Else, always good to see you, my friend. Thank you for being with us this afternoon.